An article in the Harvard Health blog talks about the health effects of too much gaming. One common example, it says, is carpal tunnel syndrome, which many gamers develop. They also develop gamer's thumb, which is also known as de Quervain's tenosynovitis, trigger finger, and epicondylitis or tennis elbow. Gaming has also been associated with psychosocial problems, such as preoccupation with gaming, a loss of interest in other activities, a loss of relationship, educational, or career opportunities, gaming to escape or relieve anxiety, guilt, or other negative mood states, and continued gaming despite psychosocial problems. Click the subscribe button and hit the notification bell so you'll know when new videos are posted. In the past several years, I've had a number of young men, usually about 26, coming to me for consulting about repetitive strain injury. And all of them have gotten injured from gaming. And all of them had trouble doing something as simple as lifting up a coffee cup. One person had just graduated. He had spent a lot of time and money getting a degree, and his career was basically on pause because he really couldn't use his hands. And it's very sad because these are relatively young people and they didn't understand the severity of repetitive strain injury or just how long it takes to rehabilitate. And you need a lot of adaptive devices and continuing monitoring in order to continue to work when you have RSI. And a lot of creativity goes into creating these situations where you can still work. So I thought it would be really good to have an expert on gaming, internet gaming addiction. And in a prior episode, we talked with Dr. Phil Reid. He's a professor at Swansea University in Wales. He has published over 240 papers, among which are studies on internet gaming addiction. So welcome back to our channel, Dr. Reid. We'd really love to hear, first of all, what is internet gaming addiction, and then we can go from there.
Well, thanks very much for having me back. That's great. Internet gaming disorder is perhaps the first of the digital conditions to achieve an official status. So this is now listed as a potential disorder in the International Classification of Diseases manual, and it's also listed in the Diagnostic and Statistical Manual of the American Psychiatric Association as a condition in need of further study, which probably means it will make it into the next manual. It's really a quite diffuse set of symptoms, but they all emerge from somebody becoming overly dependent on gaming. So they're spending inordinate amounts of time playing computer games. Now, this has a number of different effects. As you've mentioned, it certainly can have quite pronounced and dramatic effects on somebody's physical well-being for all sorts of reasons, but it also produces psychological changes as well, such that when the person can't get to game, then they start to feel anxious and perhaps depressed. But while they're gaming, and we're talking here someone who may be gaming upwards of 16, 18 or more hours per day, that's all that they do. And the rest of the life, as you imagine, will just spiral out of control. Unless, of course, you're a professional gamer, and there are some people who make their living gaming, in which case that becomes an industrial injury rather than an injury which is associated with a psychological problem. But the end point of someone who is addicted to gaming is their life falls apart, they become sad and anxious and perhaps quite lonely because they have no other contacts than digital contacts. That's not to say that all people who game are lonely or feel lonely, because there are some games which try to produce a degree of social contact. Even some of the more violent games tend to have people working together in teams, especially the massively multiple player online games can divide into teams. The problem is that once those games end, or the manufacturer of those games turns them off, that community is completely disrupted and they have no further contact. And that's the only social contact they're having. And it's rather like what happened 20 or 30 years ago to most industrial regions, where towns were set up around the local steel mill or the local mine. And as those industries declined, those communities died. And the social contact in those communities became less and less pronounced. And we were all aware of those great social impacts. But we have the same phenomenon now digitally, where the only contact some of these young men, mainly, although that gender balance is changing quite rapidly. 10 years ago, I would say you're absolutely right. This is mainly a male problem. I don't think that's necessarily so true anymore. And many young women game just as extensively as young men. But when that social contact from the game breaks down, then that's an added burden to that individual's life because that's all they have.
It's so interesting that you compared the steel mill and the community that built up around the steel mill with gaming. And I mean, whole towns were decimated and depressed in probably every sense of the word, not just economically, but also mentally depressed because of this lack of camaraderie.
Yeah.
A
And
local,
again, pushing forward with the gender analysis, certainly 30 years ago, when this was happening to a large extent, this was undermining the self-image of many of the men in those communities, especially. And they had terrible problems adjusting. The women would often suffer the fallout from the men's depression, which tends to be increased levels of domestic abuse. But similar things happen with gaming too. When a community folds, then those players often have no other means of social contact because they've put so much into their lives in their digital incarnation rather than in the real world.
and you don't really know someone through social media. I mean, meeting people in person after you've had contact with them, it used to be via the phone. You'd be talking to someone for a business reason, and you would have a picture of them in your mind. And then you'd meet them, and they'd be totally different from what you expected. There's a whole cluster of qualities that you miss.
There is, and certainly what I'm now calling old-fashioned social media, things like Twitter and Facebook, didn't really give anybody a sense of the person who they were dealing with. And people would present all sorts of versions of themselves through social media that bore very little relationship to how they really were, some for ego bolstering reasons and some for more darker reasons. So we hear of people trying to groom others into various acts. As social media is evolving and we're doing more social media this way, where we can see each other, we don't know quite how that's going to go. But gaming is one of those things where you're still acting largely through a character. I mean, going back, this is nothing new digitally. I mean, Dungeons and Dragons was going long before the advent of gaming. It's the same type of thing. But the digital world gives you an extra layer between yourself and the people you're interacting with. And that can cause in itself some problems.
One of the other problems that I've heard associated with these games is that they're intended to be addictive. You always want to go up to the next level, which compounds the problem of overuse.
Yeah.
And also, I don't know, tell me what you think about this. It seemed really hard to pull back if you have a gaming addiction because it's built into the game. You can't just play one game. I mean, if you're sitting around a cabin in a snowstorm, I think you would not play Scrabble till 4 in the morning,
Probably
usually.
not. It does have that property, and they're designed deliberately to do that. Remember, this is a business, and there's nothing wrong with that, except if you're making money on the back of other people's misery. It's fine for social media companies to make money. It's fine for gaming companies to make money. But what we now know is they are deliberately engineering their games, their platforms to be addictive. And we had this debate with cigarette companies 10, 15 years ago. It's the same with digital companies. It's fine to make money. We're all for that. That's wonderful. But if you're doing it at somebody else's expense and you're putting somebody else at danger, both mentally and physically, then there's a problem. Now, that's one part of the gaming addiction. The game itself is incredibly attractive to play, and it's designed that way. It's like a slot machine in any gambling house. It's designed to be attractive, to be noisy, to get people there. That's what the digital games have, plus all of the dopamine rushes you get from advancing through the levels and succeeding. We've also got to remember that people who are playing these games are often doing so not just because they like them. That's part of it. But there's a group of people there who are using it as an escape. Perhaps they're unhappy in their real life. Perhaps they're anxious. Perhaps they're suffering from a lot of stress. And this is a way of removing themselves from that perhaps unbearable real situation into a world that doesn't present those same challenges. And that escape is reinforcing. So that drives people back to keep using this and running the risk of overusing whichever muscle groups they happen to be using.
So, if you had some advice for someone out there who may be wondering, I feel like maybe they're saying to themselves, I think I'm maybe addicted to these games. What do I do now? Do you have any guidance that you might share with them?
I think there are two things that you would need to look at. Firstly, what's the level of this? Is your internet gaming addiction on a par with a gambling addiction? I'm not saying you're losing money from it, but is it taking up so much of your life? If so, then you do need to seek professional help. Now, this is a diagnosable condition, and it may be worth checking your health insurance to see if it's covered. If not, then you may or may not be in lucky enough position to seek private help for that. But there are things that you can do yourself. Firstly, limit your use. It's okay to do it, but you don't have to do it all the time. Set aside clear points in your day. You know you're going to be able to get to it, so don't panic. You know there's going to be that period of a couple of hours where you can game with your friends. No one's trying to stop you doing that. So you know that's coming. That's a high point in your day. But stop at a particular point. Schedule something else if needs be. If that's the only way you're going to get to stop, make sure that something interrupts you. So schedule it around those times. It will become habitual after a while, and you won't need the props after a little bit. This will all limit your usage and you'll enjoy it more.
I should think you would enjoy it more knowing you were in control.
Yeah, I think that control is part of the joy for many people. Many people who go onto these worlds tend to be I'm going to use a word that sounds very pejorative, and it's not meant to be, but it's neurotic. It's a technical word. I mean, people who are perhaps a bit anxious, they worry about a lot of things. Perhaps they don't feel they have the control over their lives that they might want. And this is an environment that gives them that. So anything that will increase that sense of control would be important. Now, this group in itself is quite important for repetitive strain. Firstly, they're involved in a very attractive activity, which keeps them there. It's also giving them lots of psychological boosts by avoiding other things. So they're drawn into it, and that's making them play more and more. They're anxious, they're escaping. But we also know that the experience of pain is heightened by the presence of anxiety. It doesn't mean it's all in your head. I'm not saying that. And it's just curious psychological things, or it's just psychological, as if, well, that doesn't count. That's not real. Yes, it's as real as anything else. It's just the cause that may differ. The pain is still there, but also it amplifies pain. It amplifies our experience of it. And because we're anxious and because we're tensing because of the anxiety, we're also giving ourselves even more repetitive strain injury.
Yes, it can become a vicious cycle. One last thing, when it comes to things like alcoholism, the the prevailing wisdom is that you can't drink at all. You seem to be suggesting, correct me if I'm wrong, that it's okay to set a limit. You'll play this game for 20 minutes, and then you've got to be off to work, or you're meeting a friend, or you're
I think
working on.
opinions differ. So we have the 12 steps program, which has a very clear conception of addiction and dependency, which is a disease, and it means that those people simply cannot handle it. Other people have a slightly different view, that this is a coping mechanism which has developed for a particular set of circumstances. And if a person can get hold of those circumstances, then perhaps they can reevaluate their relationship with that substance. Now, I think it really probably depends on the person and the severity of their dependence. For people who are very severely dependent and who have been dependent for a long time, it's highly unlikely they're ever going to be able to control that activity, and they're best avoiding it or replacing it with something else. For those people who are probably not quite at that level, maybe they can find this nice equilibrium between usage and not overusage. But that really is a discussion to have with yourself and with your healthcare provider.
You just brought full circle. I was just thinking, well, we have a plan here. Now we've raised awareness and consciousness. You can do some self-study, self-analysis, and understand yourself a little, and then get professional help if need be. So there's a path.
There is, but remember that addiction is sometimes something we're not fully aware of ourselves. And sometimes you have to take note of people who are close to you. If you get the idea that they're hinting there may be a problem, because it's very hard to go up to someone you're very close to and say, you've got a problem. But if you get the idea that they're hinting around there's a problem, you really should take notice of that.
It's so funny. I did an ergonomic evaluation for someone years ago, and it was a couple. The wife happened to be in the room, and he was playing video games, and he said he was playing them till midnight or something. And his wife immediately said 2:00 in the morning. So I kind of believed her, because she was the one who was watching the clock.
Yeah,
Yeah.
I do. People are it's very difficult. And there are also physiological reasons why that's the case. Dopamine is the neurotransmitter that we get a boost of when we like doing something. But that same neurotransmitter is also involved in timing. And
Really?
if we get too much of it, our ability to tell the time is hugely disrupted. So the two things go together. And an overuse and an underreporting of the length of time probably both have a physiological basis.
Well, if there's any mothers of teenage boys out there, you just got your answer of why the room isn't getting cleaned and someone doesn't appear to be hearing you. This has been so fascinating, Dr. Reed. I hope you will come back and talk to us some more about actually anything you're interested in. I think this is, we all use technology, and you've just brought to light so many interesting aspects that I I didn't know.
That's my pleasure, and it's incredibly important. The job that you're doing is to get information out there so people can make their own decisions.
Precisely. It's your life, your decisions, but we hope that we're steering you in a direction that's positive and away from serious repetitive strain injury.
Well, thank you very much.
Thank you, Dr. Reed.